Hi everyone, and I'm going to talk about the lack of access to national health care. The United Nations Universal Declaration of Human Rights lists medical care as among the basic human rights to which people are entitled to. However, in the United States, a majority of the people have access to basic health care, or even some don't have access to it at all, which is a problem. What's health care, you ask? Health care involves the maintenance and improvement of physical and mental health of the people. In the United States, this includes having a primary care physician or other healthcare provider to monitor general health issues on a regular basis. However, there are problems with this system that have made medical care unaffordable and difficult for people to obtain, which is a big problem. Access to health care has always been a problem in the United States and has grown to a bigger problem. More and more people of late are eating unhealthy, leading to obesity and diabetes. This increase of unhealthy people drives the prices of healthcare up, making it harder for people to afford it in the first place. However, in 2010, President Obama passed the Affordable Care Act, also known as Obamacare, to help alleviate the problems of the affordability of healthcare. And it has. The number of people who have access to healthcare has increased. However, the price of affording healthcare has also increased, which is another problem. We can see this problem even today in Congress and also in politics.
Insurance company profits have doubled under Obamacare. That was the result. This thing isn't working.
You know, here I find myself in agreement with Ted. He's right. Let's work together on a Medicare for all single-payer program. So we're finally going to get insurance companies, private insurance companies, out of our lives.
When government takes over health care, every example on earth, the result is rationing and waiting periods, and you, the citizens, being told, no, you can't have the health care you want and deserve.
And in America, we do rationing in a different way, Ted. The way we do rationing is, if you are very rich, you can get the best health care in the world, I believe. But if you are working class, you're going to be having a very difficult time affording the outrageous.
Just talked about providing health care for free from the government. You know what? The simplest principle in economics is Tonstoffel. There ain't no such thing as a free lunch. The liberal-leaning Urban Institute scored Bernie's health plan, concluded it would cost $2.5 trillion in the first year and $32 trillion over 10 years. Now, how much is that? Trillions is a big number. It's not clear what that is. Let me put it in perspective. All of the federal income taxes we pay today are about $1.5 trillion a year. $2.5 trillion means every one of us paying income taxes would have to about triple what you pay in income taxes to get an additional $2.5 trillion. Now, Bernie, no doubt, is going to come back and say, no, 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 no. None of you are going to pay. Just the rich. Well, how about if we took every person that makes over $1 million a year and confiscated 100% of their income, took every penny that they make? That would raise only enough money to fund Bernie's plan for 5 months. Here's another idea. How about if the government confiscated the assets of Apple, Google, Microsoft, Facebook, and ExxonMobil? If it came in, illegally seized those companies and sold them, that would pay for 1 year of Bernie's plan.
This is a problem and can be seen in the real world. I've interviewed a couple people who have struggled with healthcare problems. I interviewed 2 people. First, I interviewed a doctor, Dr. Chan, as well as Mr. Shui. He is just a family dad paying for Medicare. To resolve the issues of the affordability of healthcare, there should be two things. One, the government should play a role in the socialization of medicine. Socialization of medicine is just a term used to say that the government will use subsidies from taxation to lower the cost of healthcare. And two, the marketplace. The marketplace should offer more insurances that offer higher quality and cheaper healthcare for all. On a final note, I would just like to add on to say that you should take care of yourself in advance and maintain a healthy lifestyle and a healthy diet. If you do that, you'll be able to maintain yourself even though you might be struggling to afford the healthcare as it is right now. And I'd like to hope that these issues can be resolved soon as more and more people are dying. And now I'm going to conclude my research on the lack of access to national health care. Thanks for watching.